Today, April 7th, marks World Health Day as well as the anniversary of the founding of World Health Organization in 1948. Now, what does it mean for us? For more, let's turn to Professor Howard Lee from Seoul National University. Welcome back to the program, Professor.
Good morning, and thank you for having me.
Sure, thanks for joining us. First off, why is it important or necessary that we do recognize the World Health Day?
Sure. World Health Day is one of the 12, quote-unquote, official global health annual campaigns promoted by WHO, or the World Health Organization. There are other campaign days and weeks, too, by WHO. For example, World Tuberculosis Day and World Immunization Week. These global health public campaigns offer great opportunity to raise awareness and understanding about critical health issues, which is important to mobilize support for action, both at a country and international levels. To recognize World Health Day, WHO selects a specific public health concern or issue every year to highlight a priority area of concern. And this year's theme is Health for All. WHO has defined health as a state of complete mental, emotional, and social well-being, which is not simply the absence of sickness or disability. Therefore, the initiative Health for All this year envisions a society where all people across all regions have equal access to good quality health services without too much worrying about financial risk or burden. That way, we may live happy lives in a peaceful, wealthy, and sustainable environment.
Right. The theme, Health for All, sounds very appropriate at this time of the year, too. Now, what can we do to commemorate the day, World Health Day? What can we do, Professor?
There are several that we can think of. First and foremost, we have to understand that health is a fundamental human right. Health is not a privilege of somebody, such as rich people or those who live in a wealthy country or safe district. Everyone on earth must have access to health care when he or she needs it. However, more than 30% of the world's population still lacks access to basic health treatments. So we need to come together how we could reduce the health gap as fast and efficiently as possible. To make health for all a reality, we need to empower individuals and communities all together so they can care not only for their own but for their family's health as well. This can be accomplished only when we have a sufficient and uninterrupted supply of skilled health workers who are qualified to provide quality, people-centric care to us. This is why it is important to engage policymakers in the whole process. We have to ensure policymakers are committed to investing in developing new health tools and enabling health coverage as broad as possible to all in need.
Right. It's a must that no one feels left out or left behind when it comes to health. Now, as you and I have both mentioned, the World Health Day also marks the anniversary of its founding of the WHO in 1948. The organization has contributed so much, but what has the international body also done well in the past?
Yes, WHO celebrates its 75th anniversary today. WHO's 75th anniversary year is an opportunity to look back at public health successes that have improved quality of life during the past 7 decades. Particularly for the last couple of years, WHO has done a really nice job in curbing several infectious disease outbreaks other than the COVID-19. For example, they include Ebola, malaria, and Mpox, which is formerly known as monkeypox. Not only that, WHO has also shown leadership in providing guidance for governments globally as to how to transform mental health services to increase levels of physical activity and to prevent the oral diseases that affect almost half of the world's population. For example, tooth decay, severe gum disease, tooth loss, and even oral cancers.
Right. So many pending issues still at our hands left behind, but still we have the WHO working on it, and also we do mark and commemorate the day to keep in mind that health is not a privilege. It has to be accessible to everyone, all corners of the world.
Absolutely.
All right, Professor Lee, thank you so much for your time this morning. We appreciate it.
Thank you.